Today I'm going to be demonstrating massage therapy techniques working on someone who presents sciatic pain. And sciatic pain is typically, there are muscles that run across the glute in the back part of the body that attach to the tailbone in the middle and come out and attach on the outside of the ball and socket joint, on the outside of that hip bone. And these muscles run in this direction on the back side of the glute. And the sciatic nerve starts in here and runs all the way down. Many times people will present it as pain in the outside of the back of the leg, sometimes all the way down to the ankle. And so really the best way that we can affect that is to get these muscles that run across the back side of the glute, which are like this, to stop being so tight so it doesn't pinch on the sciatic nerve, if that is what's causing some of the problem and some of the pain. So we're going to go in and just get these muscles to relax. Now, back part of the hip bone is right here. It's going to run all the way up and around like this. And what we're going to do is just work on where the muscles come down and attach to that hip bone. So I wish I had a pencil. I'd just kind of draw it for you there, but I don't think she would appreciate that. So as you can tell, I'm pushing directly on the top of that bone. I'm deep enough in her that I can then push straight down. So I'm actually pushing towards her feet on the top of that bone. And we're just going to make our way around that bone and do that all the way around. And now we begin to get into a muscle that's a little bit thicker, so we don't have as easy an access. But this muscle we're going to work on now comes up here, and here's the spine. We're going to work on this muscle that goes right out here. So one of the ways we're going to do that is we're going to spread the muscle out. And you can see as I follow that muscle, I'm on the muscle, I begin to get to the edge of it, and now what I'm going to do is I'm going to push straight in. I'm pushing right towards the middle of her body. I'm on the outside of this muscle. For those of you who love food, this is a New York strip. Yeah, that's funny, isn't it? So I'm just on the outside of that muscle. And I'm just going to hold. I'm not pushing in with a whole lot of pressure. And if I did a lot of movement here, it would either create sharp pain or it would irritate our client here. And so what would she do in response to that? She would flex up. So we're just putting enough pressure in there to tell that muscle we want you to relax a little bit.